My name is Lisa Soltis. I am a cardiovascular critical care clinical nurse specialist. I work at WakeMed Health and Hospitals in Raleigh, North Carolina, and I've been in critical care nursing for 15 years. I had a biomedical background plus the medical sales, and they were talking to me, and he said, well, I thought you were a nurse. And it was like the light bulb came on, and it was like, I could do that. And I went back home to Raleigh, North Carolina. Went back to nursing school. I knew from the very beginning that I wanted to go into critical care. And what I love about it is that it gives us the opportunity to help patients when they're at their very worst, to help patient families get through that period as well, and the satisfaction of, getting through your shift or getting through the day and see that patient, even if it's just tiny baby steps, making progress from the morning to the night or from the night to the morning. And I thrive in that environment. I joined SCCM 3 years ago, and a friend of mine recommended it. When I was in graduate school finishing my degree at Duke University, my preceptors were all members of the SCCM. We looked at the Blue Book all the time and looked at the journal all the time, and we were constantly talking about research and things like that. A year after I joined, one of my colleagues and I went to my first Congress, and when it was in South Beach in Miami, when it was 30 degrees outside. It was fabulous, but it was such a great environment, and to be exposed to new technology and to have all these colleagues from all over the world involved with this. I go to the website almost not every day, but at least 2 or 3 times a week when I want to find research or find data to support my stance, or when I want to try and change practice. As a CNS, I'm very fortunate in this role because not only do I look at the patient outcomes, but then I also look at the financial impact. And so from that very first Congress, there was technology that was available there that I said, I need that in my hospital, and came back to my administration, my organization. We did a trial, and I said, this is what's going to result. If we do this, this is what's going to happen with our patients, and the cost avoidance with it. And so when I was able to present that with what the impact would be financially, they were like, this is a no-brainer. And so it takes a while to get the wheels of change to move, but once you do, you have to have that data behind it. And SCCM has just been invaluable to my practice to have that information from all over the world, from all the different practices.
I'm Maureen Madden, and I'm an assistant professor of pediatrics at the University of Medicine and Dentistry at the Robert Wood Johnson Medical School, but my clinical practice is in the pediatric ICU at the Bristol Myers Squibb Children's Hospital in New Jersey. I have been a member of SCCM, and I'm going to maintain that as long as I possibly am practicing in critical care. I think it's important. It's the only multi-professional organization out there, and I think it's a key component of SCCM. I love the fact that everyone is a part of it. There's a collaborative effort there. Everyone is recognized for their efforts, and everyone is pushed to continue to contribute to the best of their abilities. I've contributed to SCCM, and it's really also been able to allow me significant professional development. We've created a couple courses that have been directed towards nurse practitioners, and particularly in pediatrics, that hadn't existed before, so it's great educational opportunities. That's advancing it and bringing people into critical care. I think we've made a significant impact with the Pediatric Fundamentals of Critical Care Support course to educate individuals who don't routinely care for critically ill children, and I think that we'll have some outcomes that can be demonstrated to show improvement in pediatric care. But more than that, as I said, it really is a multi-professional home, and I think that it's invaluable to critical care because nobody works in isolation. I think it's an amazing event to attend, partly because it is multi-professional. You really do get to interact with everybody that participates in the ICU setting. You get different perspectives. There's a significant quality of research that's being presented. It's cutting edge. It's the environment that you get to see it within, but you also get to see the organization of SCCM and the various committees and how you can become integrated in it and contribute to it.
My name is Susan Smith. I'm a clinical nurse specialist, and I come from Texas. I am a member of SCCM, and I've just currently become an active chapter member in the Texas chapter. I've always really enjoyed being a member of SCCM. I like the philosophy that it's multidisciplinary, and so it helps to kind of bridge the understanding amongst the different disciplines. And so I always really enjoy an opportunity to be with my other colleagues in critical care to discuss care issues that affect all of us.